right. Good afternoon. Welcome, everybody. Thank you for joining this info session. Thank you for your interest in this program. Let me just have two people more joining.
Recording in progress.
All right. There's a... Okay, perfect. Then we can start once again. Good afternoon. Welcome to the information session. Thank you very much for your interest in the new program, Wellbeing Oriented Healthcare. My name is Dorothee Kröger. I'm the program coordinator, and I'm joined today by several of the colleagues, researchers, lecturers from the 5 partner universities who are delivering this program. And we have planned roughly 25 minutes to 30 minutes of input from our side to give you an overview of the program's objectives, of its content and its structure. And then we have sufficient time dedicated for your questions. The session will be recorded for those who cannot attend today. You're always welcome to post questions either in the chat or by raising your digital hand, and we're happy to answer them. Without further ado, I would like to hand over to our first speaker, Professor Maria Cristina Polidori. She's the academic coordinator of the program, to give a first input on the objectives and why this program is essential. Cristina.
Yes, so hello everyone, also from my side. As Mrs. Kröger said, I am here responsible together with my colleagues, and also I'm talking now briefly on behalf of them as well, for the organization of the contents of this master program. So basically the peculiarities, there are some things that are really special about this master program, which go beyond the dissemination that, of course, and marketing that everyone does when starting something new. We really prepared this curriculum in a very unique way in the past few years to reach all the unmet needs and also content gaps in education, in higher education. And we are very happy now to be able to start with this time during the registration, leading then to the kickoff in November. Why did we want to do that? First of all, you should know, and maybe Doro will tell you a little bit more also about the consortium in general, who we are, because of course you don't know what the frame in which this master program started, which is as you see here on this slide on the upper right side, the European University for Wellbeing. And actually, this European University is something that started many years ago under the coordination of the University of Cologne, and with up to now 12 universities Europe-wide. And they don't really, all of the universities focus on healthcare and well-being from this point of view, but actually they're really multi and interdisciplinary, working on linguistics, on humanities, science, and many, in fact, many topics. The idea is to put the focus of Europe, and not only Europe, hopefully, on well-being, because actually there is quite a discrepancy between a healthy society or a healthy continent and a continent or a society in well-being. So this applies not only to health and physical health, but it applies to many aspects of the society, like, for instance, economics or laws or ethics. So we are really understanding now, as the oldest continent of the world, that there are many, many things that could be done better in all of our individual disciplines where we are working into. And that's why we decided to open this master to many disciplines and not only to the healthcare workforce, but in general to all bachelor colleagues with a bachelor title that are interested in understanding the well-being related aspects of the healthy society, which are many, many, and are for your simplicity here summarized in these three circles that you see here: biomedical factors, social factors, and psychological factors. But in the reality, this part and the topic of this master is sustainability goal number 3 of the United States of the United Nations, in which, as you know, the 17 goals are all of them interrelated, and number 3 is this health and well-being, as actually an old definition that I will tell you in a minute. I'm closing now. But actually, we are doing something that I like to call a forward into yesterday, because 80 years ago, exactly, almost exactly 80 years ago, 78 years ago, but 80 years ago, this definition was defined or agreed upon during an evening in a restaurant among some representatives of the World Health Organization. And actually, a definition of health was put on a napkin and at the restaurant. And this definition of health was saying that health is not only the absence of disease, but it is a state of physical, mental, and social well-being. And now there are many debates about this definition, because people have problem with the adjective complete. Who has a complete physical, mental, and social well-being? Then all of us should be ill, basically, according to this definition. And also to the fact that between biomedical, social, and psychological factors, also many other factors are not listed in this definition, like, for instance, spiritual factors or economic also factors not explicitly mentioned. So what I wanted to say is that we decided to embrace all these issues and challenges and of complexity of our society of the 21st century, and include in our curriculum many, I would say all aspects of health and well-being that are not usually addressed in any of the curricula of your bachelor, for instance, or of many of most educational programs. So we work still in an intradisciplinary manner. And with this master, we go into real life, inter and multidisciplinarity. I would like to just close and give back the floor to Doro for the organization content, and also to the colleagues, saying, first of all, a big thank you for all the team, because this was a great productive work that as such already is of enormous help to the society of the 21st century, because we will publish, of course, this curriculum explaining the needs that are that have to be met still in the society. But also, I would like to thank you for coming and for being interested. I would like to leave you with a kind request to disseminate these, because we are at the very beginning today of the registration possibilities. We have lots of interest expressions already, but keep disseminating, because we don't want only the first cohort. We want to train the future and current health workforce, and we really hope to see you in the upcoming kickoff in the winter school in Cologne at the beginning of November. So thank you very much for your attention, and Doro, I give the floor back to you.
Thank you very much, Christina, for this introduction. Before we continue with the partners, I would just like to give a short overview of the structure of the program. And let me just move on with the presentation. As Christina just said, the master's program is an interdisciplinary program in the sense of that we have universities and teaching staff coming from various fields, healthcare related fields, but also sociology, philosophy, for example. And the program is also interdisciplinary because the students come from interdisciplinary backgrounds, as Christina just said. It's a fairly open target group of healthcare practitioners we're aiming at. And this interdisciplinarity pays tribute to the comprehensive approach, as Christina just said. The program is international, so the language of instruction is English, and you will be meeting teaching staff from 5 leading European universities, and your fellow students will come from, all around the world. So you really have a truly international learning experience. The program targets healthcare professionals. This is why it's a part-time program, and I'll come to this in a second. And it's practice-oriented to really support professionals in their continuous education and lifelong learning. The degree we are awarding is a Master of Wellbeing-Oriented Healthcare. That's equivalent with regard to the level and the degree with all the other master programs awarded in the European higher education area. The program carries 60 credits, and because it's part-time, it's expanded over 2 years. So 4 semesters of part-time program, meaning the workload per semester is reduced, so professionals can continue their work. And we achieve this via a blended format and a part-time format, and I'll come to this in a second as well. The partners Christina just mentioned, the partners have been collaborating in the University Alliance's EUniWell for several years now, and they all contribute with specific strengths and research foci, which they will present in a second. And as you can see here, it roughly overlaps with the model presented earlier on, and they contribute their strengths into the program, and you'll see later on what to expect and where the research strengths lies of the different partners. The curriculum is centered around 4 short-term mobilities, so 4 short on-site sessions, the winter schools and summer schools, which kind of form the key element for the practical hands-on application of a person-centered approach in healthcare, where you experience different European healthcare systems and you can network with your fellow students really on site. And these short-term mobilities are connected by virtual classes, which make up the majority of the program, so you can continue your professional work at your home location. And this leads then to the master's thesis. In detail, the cohort will study 8 modules, and the idea is that the cohort really studies all modules jointly to strengthen the networking part of the program. And I would just like briefly to focus on 2 modules, which is the project and the thesis. So 2 larger modules which cover the first and the second year, which are central elements in the program, in addition to the modules with the on-site summer school and winter schools. And the project, which covers the first 2 semesters, is a small-scale project, a practical hands-on project that is conducted by the students, the professionals themselves, in testing out or applying or evaluating, reflecting a person-centered approach or elements of this in their direct professional context. This can be a challenge you have encountered in your daily routine, an opportunity you would like to test, either in your really immediate context with your fellow colleagues or your patients, or in your local community or your national context. You will be supported by an academic supervisor in the project for the design and implementation of the project, and you will receive training in project management and research methodology, really to help you carry out and conduct a successful project in applying the skills you acquire in the other modules. In the second year, you will focus more on a research element in the thesis. And it's very likely that maybe the outcome of the project or a specific question from the project leads to the thesis topic. So you will be, again, guided by an academic supervisor in finding a research question that you will tackle in the thesis, which covers 12 months. And by finishing the thesis, you will finish the program with the 60 credits and be awarded the Master of Wellbeing Oriented Healthcare in a joint degree, jointly issued by the partner universities. I will stop screen sharing now because this was just a short overview of the program structure. And we will now come to a short pitch and input by the partners on their teaching contributions, so you can see what you could expect from the program, what is being taught. And the first one, that is our partner Semmelweis University in Budapest, Dr. Adam Orosz, can unfortunately not be with us today, but he recorded his session. So I will now share my screen with a short video by Adam Orosz. He's the coordinator of the program at Semmelweis University in Budapest. Now give me a second. There he is.
Hello, everyone. I'm Adam Orosz from Semmelweis University, and I would like to present to you our module in the master's program, which is titled Personal and Social Transformation, which is really about how to build well-being in healthcare, especially from psychological and social directions. I'd like to begin with a simple question. Who takes care of the people who take care of others? When we think about healthcare, we often think about diseases, diagnoses, and treatments. But healthcare is, above all, about people. Imagine two patients with the same diagnosis receiving the same medical treatment. One recovers well, while the other struggles to cope, doesn't follow treatment, and has poorer outcomes. What makes the difference? Very often, it's not biology alone. Psychological factors such as resilience, communication, motivation, meaning, and social support play a crucial role in health and recovery. And the same is true for healthcare professionals. Their well-being directly influences teamwork, patient safety, empathy, and the quality of care they provide. This is why understanding psychological well-being isn't an optional extra. It is becoming a core competence for modern healthcare professionals. However, well-being doesn't exist in isolation. It is shaped by three interconnected levels. First, the individual, our own mental health, resilience, communication skills, and sense of purpose. Second is the organization. Even the most resilient professional can struggle in a workplace characterized by chronic stress, poor leadership, or burnout. Creating a healthy organizational culture is therefore essential for sustainable healthcare. And third, society. An aging population, family caregiving, health inequalities, legislation, and public policy all shape how healthcare is delivered and experienced. Our module, Personal and Social Transformation, brings these three perspectives together, because lasting change in healthcare begins with personal transformation, but it also requires organizational and societal transformation. So how do we teach these topics, and what will you learn, and how will you learn? Students will actively engage with real healthcare challenges through communication training, role plays, case discussions, supervision, guided self-reflection, and collaborative learning with an international group. Together, we explore questions such as how can we prevent burnout instead of simply coping with it? How can communication strengthen therapeutic relationships? How can organizations promote well-being rather than contribute to stress? And how can healthcare systems support both patients and professionals? Our goal is not simply to provide knowledge. It is to help students become reflective healthcare professionals who can improve well-being for themselves, for their colleagues, for their patients, and ultimately for society. Because we strongly believe that healthcare is not only about treating disease, it is also about creating the conditions in which people can flourish. So with that, I'm really hoping to meet you in Budapest during the program, and thank you.
All right, thank you very much to Adam. I'll hand over now. We move on into the curriculum in the second semester in Budapest, and the third semester will be at the University of Murcia, and I'm happy to welcome Professor David EU from the University of Murcia. He's the coordinator of the program at the University of Murcia. So I hand over to you, David.
Thank you. Thank you. Thank you so much for inviting me. It's my pleasure to be here today. So, as Doro said, in Murcia, University of Murcia, we want to cover a very important model in this master. Is called multidimensional aspects of well-being. So, as you already know, the concept of homeostasis or biological homeostasis has the ability to maintain like a stable and neutral internal environment in order to stay healthy, like to keep your blood sugar in a very narrow range or to keep your temperature. But at the same time, this fantastic neuroscientist, Antonio Damasio, coined the concept of sociocultural homeostasis. And then, so it's an expansion of this biological homeostasis that says that human culture, social systems, and institutions evolve as a macro level instruments or tools in order to regulate human life, not only for survival, but also to flourish and to develop quality of life, well-being, and to project yourself into the future. So at some point, we can say that social and cultural elements are our second nature. So for that reason, social determinants of health are very important. And we need to understand these social determinants of health because they are elements, essential elements to change or to transform healthcare from a system that mainly treats diseases to another system that treats people and their circumstances. For instance, a very clear example, clinical care only accounts for a very low percentage of health outcomes. The other high percentage of health outcomes are driven by other factors, and those factors are social factors. For instance, environment, neighborhood, healthcare quality, community, social network, educational access to quality education, economic stability, and so on. So knowing those social determinants of health are essential to have in the position, to know the etiology of the diseases, to tailor care plans, to reduce hospital readmissions, to increase motivation of professionals, and to increase health equity. And also it's quite important to cover or to bridge the gap between treat diseases and treat the circumstances of the people with diseases. And in order to do that, we need to cover and to understand these social determinants of health. So from this multidimensional aspect of well-being from the University of Murcia, we're going to cover to immerse all the students in real scenarios, covering from early intervention and infant development with real professionals, real people, real patients, and real users. Also to nature-based interventions, trying to understand the importance of nature. In this case, for instance, this professor from New York University, Eric Klinenberg, that has got a wonderful book. It's called Policies for the People. It says that in order to have a healthy and democratic societies, we need common spaces for everyone. For instance, these days with these high temperatures, we need climate shelters, for instance. And climate shelter is a very good element to keep our health. And it's a social element that has to be taken into consideration. Also, we will cover the importance of resistance training and nutrition in chronic diseases, for instance, cancer. We also cover the importance of older adults daycare centers and also the easy access to rehabilitation. And of course, we're going to cover social prescribing through a very interesting approach that is social theater and how arts and theater can improve quality of life and well-being of many patients. And you are going to do that all the time through a very immersed and very real scenarios, interacting with real professionals, real users, real patients, in order to understand the importance of social determinants of health. And finally, it's quite important for us, for our perspective, to understand that we need to cover and we need to invite more professionals to the health systems. So if we cover the social determinants of health, we're going to be able to invite other professionals that can contribute and interact with the more ordinary professionals that you already know that are important, but they are need to improve this health and also to really approach these difficulties to improve health through an interdisciplinary, transdisciplinary, and holistic approaches. So we are very happy to provide this approach from University of Murcia, trying to cover all the importance of the social determinants of health. So thank you very much.
Thank you, David, for the illustration. And as a final pitch from our side, I'm happy to welcome and introduce Professor Fiammetta Cosci. She's the program coordinator at the University of Florence. So Fiammetta, looking forward to your input.
Excuse me, Doro, I wrote you something in the chat. Thank you.
Yes, I'm recording the session, so I'll answer via mobile. Fiammetta.
Yes, thank you. I hope you can see my slides and hear me.
Yeah, we do. Now in presentation mode as well. Thanks.
Okay, thank you so much. So thanks for this kind of invitation. I'm really pleased to illustrate part of the activity that the University of Florence will offer during the master. In particular, we will take care of what has been named bring well-being into practice. So this last part, this last module. As already mentioned, each site will run a school in person, and in particular the summer school, the last summer school will have as venue the University of Florence. We will take care of not only to the module pertaining to the summer school, but also to the preparation to the summer school. So the preparation will be online for 2 credits, while the real in-person summer school will cover 5 credits. Regarding the preparation summer school, we are thinking to devote 2 half days to work on 2 selected topics. In one case, the use of the biopsychosocial model to prevent surgical complication, also bringing some example from our academic hospital of a pre-habilitation clinic. So a clinic which addresses rehabilitation before surgery. And on the other half day, we will give example of the use of biopsychosocial model in preventing delirium. In both cases, as well as when we will be in presence in Florence, we will use the problem-based learning approach, so that mainly after each lecture, the participant will be asked to work together in small groups in order to propose a project based on a specific assignment they will receive. Regarding the summer school in Florence, this is more or less the structure. As you can see, we will touch different topics, still in the respect of the multi, inter, and transdisciplinary elements of the master. So, for instance, we will cover the biopsychosocial model according to the gerontological view and the experience of the support of animals for elderly. Or we will propose the example of biopsychosocial management of functional disorders such as fibromyalgia or migraine. A couple of colleagues are experts in socioeconomic and social demographic variables, and they will embed this variable into well-being. Also, gender medicine will be illustrated in order to highlight pitfalls and changes. We will also make referral to technology, because of course technology and well-being can be intertwined today, so it's important to evaluate pros and cons of this kind of intertwining. And we will have also a lecture from a colleague who is expert in One Health and is particularly active in working activity in South America, and particularly in Bolivia. Of course, we will reflect on health and well-being in palliative care. We will have also the opportunity to speak with 2 colleagues, one expert in pediatrics, so well-being in kids, who will allow us a visit to the main pediatric hospital here in Florence, which is a referral at the national level and in central Italy. And also we will have the opportunity to visit the interdepartmental research center for the development of new minimally invasive techniques. So mainly this is based on surgery, but surgery integrated with several other disciplines in order to have a comprehensive view and care of the patient. And finally, also well-being in prevention will be touched with the example of vaccination campaign, and is based as according to the biopsychosocial model. All these lectures will produce material for reflection and to work on in small groups based on the problem-based learning model, which I mentioned before. And for this reason, the last day will be devoted to the presentation of the project developed during the week by the groups. And of course, each group will choose the project that prefers, and a prize will be also, a little prize will be also given to the best, let's say, project. I want also to mention that in addition to the title, the European title delivered by this master course, based on our national regulation, we have the opportunity also to deliver an additional title, which is for us named First Level Master Course, which will be awarded uniquely by the University of Florence. Of course, these are my contact and also contact of Irene Caradori, who is the administrative staff at the University of Florence, specifically devoted to this program and to more in general to the EUniWell Alliance activity. Many thanks for your attention.
Thank you very much, Fiammetta. You will find all the contact details of the coordinators on the website as well. So thank you very much. Before we come now to the question and answer session, let me just give the word to Christina once again to wrap up our presentation, and then we'll come to the question and answer session. So Christina.
Yes, so thank you very much, Doro, and thank you very much, Fiammetta and David, and also from online, the Adam, for the wonderful presentations. I hope you could see and recognize the enormous multiplicity of the topics which you will be exposed to, and those we will be introduced, as we mentioned before, from a week, the on-site winter school in Cologne, which will be responsible for the delivery of the contents regarding mainly biomedical issues of well-being. So in this sense, you will be exposed to the lifelong impact and also determinants of well-being across life. And that's why we decided to do an excursus on the clinical and biological basis and consequences of well-being across life. That's why we have, you will have lectures on site with on about healthy life. So not only longevity in the sense of evidence-based medicine and information and science, but also on the multiplicity of the determinants that maintain health across life, including those who have been mentioned by David and Fiammetta and also Adam, so in a biopsychosocial and multidimensional sense, but with a strong biomedical and clinical basis. So you will be exposed to the information about planetary health, One Health, human health in the sense of determinants of molecular and clinical and organ dysfunction leading to disability and impairments across life, not only as far as aging is concerned, but as you know, all people, all organisms age. So we will have, you will be exposed to the pediatrics, well-being of in pediatrics, well-being on birth medicine, well-being on aging medicine, well-being and prevention, well-being and general medicine, but everything in the sense of the maintenance of intrinsic health and more than prevention. So we in the across the whole course, kicking off in with the biomedical hub in Cologne, but all across the disciplines that you heard until now, you will be exposed to health and not to the deficit-oriented, reactive-based system, but on the determinants of the maintenance of the World Health Organization principle of intrinsic health, and also the, of course, in the frame of the 17 sustainability goals of the United Nations, in particular, number 3, health and well-being connected to all the other 16. So this is really ambitious. And it will require also a lot of engagement from your side, but we made it possible with the presence only in 4 weeks, by the way, in beautiful cities of Europe, and also the exposure to all these great, excellent centers of higher education in the different topics. I think that's pretty much for now. I would say that we can start the discussion and the Q&A session. And once again, thank you all for being here today.
Thank you for those concluding words, Christina. I can answer one question directly from the chat. This session will be recorded and made available on the website. So whoever would like to review it or recommend to watch it to fellow students or colleagues is able to do so. All right. Are there any questions to the academics lecturers here?
Hello, Miss. I hope you can hear me.
Yes, we do.
Yes,
Hello.
we do. Hello. So I'm Himavarsha from Semmelweis University. I'm a second year general medicine student, and I'm just a bit worried. Like, how is this course like being? Is it like an elective course, or how is it being included with credits? And how am I how am I eligible for this course?
Thank you very much for the question, which brings me to the question of who's the target group and who's eligible for to participate in the program.
Okay.
Let me just give you an overview by sharing the screen. I just need to move on here. The program actually targets healthcare professionals, so it's designed for professionals with a minimum amount of working experience of 12 months after the bachelor's degree.
Okay.
So that 12 months of professional experience in a related field in healthcare and related areas, that's a requirement because the program directly targets and includes the professional background of the participants. So once you finish your program and start working and you say you want to continue, then this is the exact program for you.
Yes. Okay. I got it. Great. Thank you for that.
You're welcome. And maybe just to wrap up this topic of the target group and how to apply. You require a degree in healthcare, and as mentioned before, it's a relatively wide interpretation in the sense of healthcare and related fields. You need to provide proof of professional experience. You don't have to work at the moment. So you just need to prove that you've worked 12 months in a related field after your bachelor studies. And you need to apply with an idea for the project, for the small-scale project, something that might arise from your daily routine. And we have a template for this short outline of the project sketch, and the application deadline is 3rd of September. Further questions? If not, I'll just wrap up with the last slide of mine, just sharing it. And we have put out all the information we wanted to, and that is just quickly on the application process. The application portal has opened today, so application is now possible. It's administered and coordinated by the University of Murcia. It's a fairly easy, straightforward application portal where you just put in some of your information and upload the relevant material. The documents which are required, which is your transcript and your certificate of your bachelor's program, and if you want to also your master's degree, the project sketch where we provide a template, the language certificate proving your English skills, and a proof of your professional experience in terms of a letter of recommendation or a certification of your previous employee. In addition to those documents, enrollment in the program requires an official review documentation of your bachelor's degree provided by an external service provider, UniAssist. And that is something that each applicant needs to obtain themselves. So we highly recommend to obtain this review documentation as early as possible because it might take 4 to 6 weeks. You will find all the information on the website. And if you have questions, always reach out. We're happy to assist that you have all the documents ready once enrollment starts in October. And again, finally wrapping up, here's the information. In addition to this session, we have the international website, we have the website of the University of Cologne. You can always reach out to Christina and myself via our joint email address. The contact details of our colleagues who joined us today from the partner universities are also available on the website. So you might also want to reach out to the colleagues at the partner institutions. All right. Last chance if you have any questions. Then we thank you very much for your participation. We hope, as Christina said, to see you in the program in the fall. We look forward to your applications. Christina, you wanted to say last word, final word?
I would say also on behalf of my dear colleagues that we wish you in any case all the best, and go and search out for the needs in your own discipline to look about the overall perspective of health and well-being, and get back to us if we can help. Thank you.
Thank you very much. Have a lovely afternoon. Bye-bye.
Bye-bye.
Bye, thanks. Bye-bye.